Good afternoon, everybody. Good afternoon, Virginia. It is 4 o'clock. That time we come together, at least a couple days a week, to remember that we're going to get through this, and we're going to get through this together. I heard that line used by somebody just yesterday. So let me first, since this is the first public press conference that we've had since the presidential inauguration, congratulate President Biden and Vice President Harris. This administration, my administration, the Beshear Coleman administration, worked well with the last presidential administration, and we look forward to working well with this one. I also want to express my appreciation that in the first full day that President Biden has been in office, he specifically addressed the coronavirus pandemic. And so we certainly have hopes moving forward that the type of work that the White House task force had been doing will continue. And as we talk in a minute, one of the most important things that I heard was a push to increase supply of vaccine, that being our primary issue that we're facing right now, given how efficiently we are now getting it out. So congratulations to our new presidential administration. We look forward to working with you. And let me just add that at a time when just weeks ago, we had a domestic terror attack on our U.S. Capitol, where we have seen things on our Capitol grounds here in Frankfurt that we all disagree with. I hope that we can come together as Americans, both to push back on domestic terror, white supremacy groups that would push hate, fear, and terror, as well as come together to fight a virus that has now killed over 400,000 Americans. I've been telling you that we are at war with this virus. The new president said the same today. This is something where the virus doesn't care what political party you are in. It'll kill anybody that it can. So now's the time. Things are too important. If what is attacking us in this virus doesn't care about party, we can't either. Just Americans fighting COVID each and every day. And if we can truly believe, and all of us come together in that way, we can protect each other in these coming months as we distribute this vaccine. I was also excited yesterday when the National Governors Association announced that I would help lead a bipartisan economic recovery and revitalization task force along with South Carolina Governor Henry McMaster. We're going to be tasked with guiding states on issues including energy, environment, infrastructure, land management, state stabilization, and taxes. I was deeply honored and humbled to be asked to do this by the NGA and its chair, Governor Cuomo. But the reason I said yes wasn't for any title. It's because it meant that Kentucky's interests in rebuilding our economy, in building it better, in trying to be a leader in the post-COVID world, it would give us the tools, the information, and the stage to bring Kentucky's challenges coming out of this pandemic to the country and to the federal government and all of its various partners, a chance to get your concerns front and center and to get something done about them, not just here, but at the highest level. I think this gives us in Kentucky a leadership role in making sure that after going through some of the darkest times, we can create a hopeful future where we can dream of possibilities that we previously thought maybe were out of our reach. That's the goal. The global health crisis has certainly upended economies the world over, and there isn't a state or territory in the United States that's been spared from its devastating impacts. Here in Kentucky, we have worked to protect our economy and to prime it for success as we come out of COVID. So I'm looking forward to talking about what we've learned, about knowing that to sustain our current economy and to ensure that it is healthy coming out of the pandemic, the most important thing we can do is successfully manage our way through the pandemic in terms of public health. The NGA created 2 other panels, Pandemic and Disaster Response and Community Renewal, which are also chaired by 2 governors from differing political parties. In the end, this task force gives Kentucky a prime seat at the table on the post-COVID economy. And the reason I said yes, and one of the things I'm going to work for every day in this spot, is to make sure that Kentucky is a leader in that economy. We don't always have chances in this state that I and you love so much to be not just in the room where it happens, but to be leading in that room where it happens. Speaking of post-COVID economy and making sure that we are primed for success, we've announced that this administration's goal and what we intend on achieving is getting broadband internet access to every single home, knowing that it's not just important for business, but now for school, even after COVID, for healthcare with telehealth and where it is. I talked about this in my State of the Commonwealth. And while we put money in the budget that I hope ends up in the final budget to help move this forward, we have been taking steps behind the scenes each and every day. Part of those steps is identifying every area, and if we can, even every household that needs a better internet, fiber to those homes. And the Lieutenant Governor and her cabinet have been taking a key role in this. So to discuss that, to walk through what's really an exciting announcement about important steps that are going to help us get to everybody having that internet access, that broadband that's going to keep them healthy, make sure our kids continue to learn, and enable and empower small businesses everywhere to reach out to customers, not just in Kentucky and in the United States, but around the world. This is a really key step. So I'm pleased to introduce Lieutenant Governor Jacqueline Coleman.
Thank you, Governor, and congratulations on your selection to the task force. That's exciting. So when Governor Beshear and I took office just over a year ago, we spoke about the growing importance of our internet as part of our state's infrastructure, a growing infrastructure, and certainly the internet has a growing presence there after the COVID-19 pandemic. We've seen the need for strong, reliable internet access, and we've seen that need grow exponentially. Countless Kentuckians rely on services to keep their families safe through telework, telehealth, and online learning. Communities count on internet service for economic development and communication. Several months ago, I announced our administration's plan to get internet access to every K-12 student across this Commonwealth. We dedicated $8 million worth of federal CARES funding to that project so that every K-12 student would have access in Kentucky. When we started, it was estimated that about 10 to 15% of Kentucky students did not have access in their own homes. I'm happy to announce that that number is now declined to 2%. But we are committed to closing the digital divide for every student across this Commonwealth. So today, we are moving forward with the first step of the Kentucky Broadband Initiative for all Kentuckians. I'm excited to announce Speed Test Kentucky. Speed Test Kentucky is an online speed test that measures the strength of your internet connection. We already know that rural areas in our state lack adequate internet services, and that speed test will narrow our focus so that we can prioritize those communities. We're asking every Kentuckian, no matter where you live, to help. And I'm going to say that again. We're asking every Kentuckian, no matter where you live, to help. All you have to do is go to the Education and Workforce Development website, perform the speed test, and then tell all of your friends by using the hashtag SpeedTestKY. So I'll tell you a little bit about the speed test. First of all, it is free. It is totally anonymous, and it takes about 30 seconds. And if you have kids at home, students, I'm going to ask you to help your parents and your grandparents figure this out so that we can get as many people involved as possible. All you have to do is enter your address, click on begin, and the test runs itself. After 30 seconds, you'll see a readout of your internet speed and you're done. It's really that simple. This is the first step in ensuring that all Kentuckians have access to fast, reliable, and affordable internet. We need as many Kentuckians as possible to complete this test. Once we have enough data from step 1, step 2 involves building a map all the way across Kentucky with our strongest and weakest points of connection. Using that map, step 3 is going to involve leveraging partners, both public and private, to provide broadband coverage in areas that need it. Individuals without Wi-Fi access in their home can actually visit their local library or other locations like stores or restaurants that offer free internet access, and they can enter their own address as being someone that has no available service. We certainly need those folks to do that as well. Governor Beshear and I will be providing weekly updates to the number of Kentuckians who have taken the test until we reach the deadline of February 18th. In true Team Kentucky spirit, we have a large contingency of partners, and that speaks to exactly how important this project is. The next slide is a list of partners, and I want them to know how grateful we are for them, that they are helping us to build a better Kentucky for everyone. So as I wrap up, let me recap and tell you to please visit the address on the screen as soon as possible, but certainly before February 18th, to complete the speed test and know that you are helping us to build a better Kentucky for everyone. Thank you. Governor Beshear.
Well, thank you to Lieutenant Governor Coleman for spearheading this. Folks, in the end, it's pretty simple. If we want to make sure that everybody has high quality access to the internet, then we need to know everywhere, very specifically where we don't. By doing these speed tests all over the Commonwealth, we can identify, we hope with granularity, exactly where we need access, where we need better access. And so by entering especially homes and addresses that don't have any service is going to be one way as we take the next steps, we can get it to you. That's one of the reasons that we put $50 million in our budget to help run fiber really to houses. You know, there are some areas, it might be numbers of people or others where the basic economics for one of the private providers doesn't work right now. But states have been able to develop programs using funds like that $50 million to help make those economics work, get that fiber into the home and get you that fast internet connectivity that you need. But when we reach that point, if we don't have your address, if you don't have it, if we haven't had the speed test, we might not ultimately get it to you because it hasn't been identified as an area where we need that help and where that speed needs to increase. So help us out. Everybody wants fast broadband, fast connectivity. This is the way that we ensure we know exactly where we need to get it. And these are steps that other states have taken when they have engaged in one of these programs. It's really exciting. It is in the works. Let's make sure that we lead in a post-COVID economy, which requires these steps. All right, talking in general about the coronavirus, wanted to share some statistics, which we haven't shared in a while. The first one is a different way of showing how well Kentucky has done in protecting each other and keeping people alive. And that's showing the mortality rate of Kentucky as compared to both the U.S. and the world. If you look at this here, the world, about 2.2% of people who get COVID-19 ultimately die, with COVID-19 being a factor in that death. And while you might think that is a low number for viruses, it's a high number when you think about how many people have been infected worldwide. It's just like our number, 1%, less than half of the world's. Still, if you have 3,000 plus people a day who are contracting this virus, 1% creates a really tough death toll. In the United States, it's currently 1.7%. We have lost 400,000 plus Americans to this virus. But this, I think, is a testament is a testament to providing education to Kentuckians about this virus and about what to do if you contract it. It's a testament to our testing program, whereby we can, once somebody is positive, reach out through contact tracing, tell them what to look out for and when they need to go to the hospital. And it is a testament to our healthcare workers who have done a better job than the country and the world at keeping our people alive. So if you're a nurse or a doctor, if you're anybody working in that healthcare system, thank you. You have you've done your Commonwealth proud. You've done your country proud. And on those hard days, just remember, just looking at this, you have saved countless of lives. And right now, while nobody wants to get COVID, in many ways, if you have to get it, you're really lucky that you're in the Commonwealth of Kentucky, where we currently have a bed for you, where we currently have ICU space for you, and where our folks, our healthcare heroes, are working so hard each and every day to try to give you the best possible result. A couple of other statistics I want to go over, some demographic statistics. So, and these are all where we know. In overall cases, about 47% of cases are in men, 53% of cases are women. Average age of someone who's contracted COVID, just 42.3 years old. On race, it's about 84.9% white, 8.6% black. 5.9% of Kentucky cases have involved a healthcare worker. So again, when we talk about heroes, they go into those settings knowing that they may well contract the virus. On deaths, 49.4% male, 50.6% female. Average age on death is 77.6 years old. And then where we know race in terms of deaths, we've seen a major change since earlier in the pandemic when we saw huge disproportionate impacts. Currently, 87.7% of deaths in white Kentuckians, 9% in Black or African American Kentuckians, and then the rest of it in other racial demographics. All right, vaccine update. Let's show again through last week the stair-stepper chart on how we're doing. Folks, I'm really proud of this. And on Monday, we'll give you a new vaccine update. But in our state-run program, where the federal government hadn't contracted with Walgreens or Walmart, we're not only doing better every week, we can now provide significantly more vaccinations than we receive supply. Think about that. Having to build a plane while we're flying it. We are now so efficient that we have outstripped the supply that is coming to us. And I think that this is a good sign, but it also points out to what our challenge is going to be moving forward. And in our overall numbers, and we'll provide an update on Monday, we realized that anything allocated had been put in our overall number of vaccines in Kentucky, when in fact we hadn't received a lot of them. That we were telling you how many we had versus how many people we vaccinated, when a significant portion of how many we had not received. The federal government had just said they were shipping them to us. This is one of the reasons, what you see here, doing 80,000+ vaccines in any given week is why we're one of the best in the country at this. And in fact, we had a federal government official on the phone with us the other day that gave us an A+, and may have mentioned best in our region on vaccinations. But here's our challenge. We showed you this on Tuesday. It's two numbers that show you what we face. Last week, we vaccinated 83,624 people. And remember, we're ramping up our capacity, but this is what we were able to do even before we bring our regional centers online. But this next week, we're only getting roughly 57,000 doses. So to everybody out there who wants their vaccine now. I get it. This is a deadly virus. This is why everybody can't get it right now at the same moment. We're ready to get it to you. Dr. Stack said yesterday we could probably do 250,000 vaccinations a week. But we're only getting 57,000 from the federal government. The supply simply isn't there. We can't give vaccines we don't have. And this also is the reason that we need our providers, those that want to give the vaccine, to be patient. So we've got over 1,500 health departments, hospitals, pharmacies, clinics, you pick it, registered to provide vaccine. If we sent every single one of those vaccines, each one would average 36 total doses. So what we'd have to say to the people of the Commonwealth is, here are 1,500 providers and links to their phone numbers. You start calling, and I hope you can be one of the 36 people vaccinated. I hope we can understand that that's just not doable. And so to all those providers out there, please understand that what we're facing is a supply issue. If we had more, we would want you to have some. But I hope in the midst of a pandemic that our first reaction isn't me, it is we. So in other words, if you were selected to provide vaccinations to healthcare workers or EMTs, but now we're in a K through 12 program where there is another provider in your region that's doing it, I hope you're excited that there are vaccines going in people's arms in the region, and not upset that somebody else may be doing this piece when you were doing the last piece. We really need to be together on this, understanding that this is not a competition. This is about us trying to find the right partners for the right phase. I'll give you another example of that. When we looked at just healthcare workers, or even phase 1B, groups could do that. That we're going to do, say groups of 100, because people weren't calling to sign up. We had already identified these people, and that made a pretty good program where someone could go specifically to that group and vaccinate them. But when we hit group 1C, there's going to be over 1 million people, that can now get the vaccine. So we got to make sure every provider at that point can handle 100,000 people calling in the first 30 minutes that they open up without everything crashing. So please, we need understanding. And the other thing I'd say is every minute that the Department for Public Health has to provide that explanation to one provider or another is a minute that they're not helping us be more efficient on getting the vaccine out and or continuing our strong work on testing and the rest. So please, the patience is really, really important. What's got to be key here is getting as many people vaccinated as quickly as we can, and we're showing that we can do that. It can't be a me, it's got to be a we. All right, moving into today's report. Today we've got 3,728 new positive cases of COVID-19. Sounds like a lot. It is a lot. We need fewer cases, but it's also the lowest total for a Thursday in over 4 weeks. It does appear that 1 week, which was our highest ever, about 2 weeks ago, that we are seeing a decline from that week, but we are still at a level higher than we should be. But I think that all of us that are working on this are glad to see the numbers coming down. Today we have 1,604 Kentuckians hospitalized. That's down 74 from yesterday. 4 less in the ICU, 395. 4 up on ventilators, so 209. Let's be thinking about them. Our positivity rate is down again, 11.05%. Again, far more than we want, but that trend in seeing it decrease is a good trend. And we have 116 red counties. That's actually the fewest we've had in a while. None of us want 116, but we do want to see that number going down and continuing to go down. The hard part, though, about today's report is it's the most number of deaths we've ever had at 58. And this is because we have had so many cases recently. As we saw that exponential growth that we were able to stop, as we've seen the post-holiday bump. Today, 58 Kentucky families are going to be struggling, and we're going to need to be there for them. I'm going to go through this. It's going to be hard, and it's going to take a while, but remember, the length is due to how many families are going to be hurting today. We lost a 99-year-old woman from Adair, a 78-year-old woman and a 64-year-old man from Allen, a 68-year-old woman from Boone, an 84-year-old man from Caldwell, an 83-year-old woman from Campbell, an 82-year-old woman from Carroll, 72-year-old man from Carter. We have a number from Davis County, including a 45-year-old woman, an 82-year-old woman, and then men ages 76, 84, 89, 92, and 70 and 92. We lost 2 men from Fleming County, ages 76 and 81. 2 women from Floyd County, ages 77 and 91. A woman from Franklin County, age 89. 2 individuals from Gallatin County, an 82-year-old woman and a 69-year-old man. 71-year-old man from Grayson County. A 66-year-old man from Hancock County. A 77-year-old man from Hardin County. 67-year-old woman and a 64-year-old man from Harlan County. 94-year-old woman from Hart. 61-year-old man from Henderson. 84-year-old man from Hopkins. And a pretty long list from Jefferson County. A 73-year-old woman, a 78-year-old woman, a 78-year-old woman, a 79-year-old woman, an 81-year-old woman, an 84-year-old woman, a 91-year-old woman, a 31-year-old man. He's 12 years younger than I am. A 64-year-old man, an 88-year-old man, and a 92-year-old man. Those are all from Jefferson County. Kenton County lost 4 additional individuals, 3 women ages 75, 77, and 78, and an 85-year-old man. Lost an 89-year-old woman from Lewis, a 79-year-old man from Logan, a 93-year-old man from McCracken, a 72-year-old man from McCreary, an 88-year-old man from McLean, a 60-year-old woman from Marshall, and a 91-year-old woman from Marshall County. 73-year-old man from Martin, 73-year-old man from Monroe, an 80-year-old woman from Ohio County, 73-year-old man from Oldham County. 2 individuals from Trigg County, one a 46-year-old woman, and the other an 86-year-old man, and a 73-year-old female from Wayne County. That is a lot of loss. And it brings our total number of deaths in Kentucky to 3,301. It is staggering. And so tomorrow, we're going to be memorializing those individuals in a ceremony where we're going to end up placing an American flag on our grounds here at the Capitol for every single individual we've lost. And as we move forward, we're going to keep doing that. These are all children of God, loved by their family, needed by their community, deeply, deeply missed. And today we're sharing the story of Peggy Lynn Davis from Ashland, Kentucky. She was only 67 years old when she passed away on Friday from COVID-19. Peggy was loved by all, and we saw that through the outpouring of love for her family mourning her loss. Stories of her spirit, her kindness, and her love flooded the page, highlighting just how much Peggy will be missed. Born and raised in Ashland, Peggy worked in healthcare and built her own successful business, even being recognized nationally. Despite this, Peggy always downplayed her accomplishments, saying her greatest accomplishments were her children, one of which I've known for about 10 years. Now mourning Peggy's loss are her husband, Robert Davis, their 3 sons, Bobby, JP, and Wesley, and her 3 grandchildren. Her family said Peggy will be remembered as a selfless mother, not just to her family, but to everyone she cared for throughout her life. Today, our thoughts and prayers are with Robert, Bobby, JP, and Wesley, and to them, to her entire family, to all those grandkids, we are so sorry. Shouldn't have happened, and we will all work harder. 67 is far too young to lose a mother, to lose a grandmother. And we are thinking about you. We care about you. The people of this Commonwealth love you. We lift up her spirit. We light our home screen for her and everybody else lost. There is a wreath on the front of this Capitol that lights up green every night that I hope is some beacon of compassion for you in this moment. And when you hear bells ringing at 10 a.m., know they're for you. Know they're for those that we have lost. My faith tells me that while this is hard, Peggy and everybody else we've lost is going to an incredible place where she'll be waiting for you. Long-term care, 76 new residents, 55 new staff, 24 new deaths. Shows you why the long-term care program was so important. We are almost through every facility's first round of vaccinations. That's our partnership with Walgreens and CVS. All right, we will open it up for questions. We also have the Lieutenant Governor here for questions on the broadband initiative. We have Dr. Stack with us remotely as well to correct everything I say wrong. We'll start with Stu Johnson from WEKU.
Good afternoon, and thank you, Governor. I have a couple of questions this afternoon. As you just have announced the 58 deaths today, when is there modeling that shows when the deaths could decline due to the vaccination? That's my first question. And then the second is a housing question, is will there be an extension of the state eviction moratorium in concert with President Biden's extension through March 31st?
Yes, we will extend the eviction moratorium once that is official through the federal government. We did that the last time. We will do it this time. I haven't seen modeling yet on vaccination, but certainly when long-term care, for instance, is through their second round, about 10 days after is when they've proven that 94, 95% effectiveness of the vaccine. That'll certainly have an impact when 66% plus of our deaths have been in long-term care. So that's going to happen, but we don't have specific modeling yet because it's a brand new virus, a brand new vaccine, and long-term care is just being vaccinated now. But can you put up the stair-stepper chart about cases? What we do know is that deaths trail cases 2 weeks to a month. And so as you've seen us go up in cases, but then come back down, if you model out weeks after, then what we should be seeing if we are on a decline right now is 3-4 weeks from now to see a decline. But every time we get lax and the virus increases, you see the slope up. Every time we even plateau too high, I mean, the consequence is increased amounts of death. So take 1% of however many cases that we have in a week, and we can expect to have that many deaths 3 to 4 weeks afterwards. It means what we do has real consequences, and thus far has had at least 3,301 consequences. And that's not even taking into account long-term health effects that we may see. So please, everybody, keep doing a good job. Keep wearing your mask. I do think we have seen a real uptick in people wearing masks, and that's a really good thing that may well explain what we're seeing in the numbers right now. So please, everybody, keep that up. I'm very proud of what we're seeing on mask wearing right now. Josh James from WUKY.
Thanks, Governor. While we're not aware of any official cases of the new variants of COVID-19 in Kentucky, experts are essentially saying it's already likely here in just a matter of time. How is that affecting your thinking and planning going forward? And is that renewing any concerns about capacity in the state?
So we have not detected the variant yet, and we are looking for it in the ways you do that, genetic sequencing of the virus where it's found. But certainly Dr. Birx and others believe that it is here and elsewhere based on some of the increases that they are seeing. It just means we have to be even more vigilant. That we showed that. Can you show the stair stepper chart again that we just looked at? When we look at what we think is the bump from holiday gatherings, what it would mean is those can be even more severe and pronounced. That maybe over the spring, if something like that had happened, then it would get a certain amount larger, but now it can jump even more. It does make the potential consequences that much more serious. So while it doesn't have us taking specific steps on mitigation, it is pushing us to develop more and more and more capacity to vaccinate faster and faster and faster. And while our capacity has already well exceeded the supply we expect to get in the coming weeks, we want to be ready, because if the new administration or anybody else can get us more vaccine, I want to be able to get it out that week, even if we have no prior notice. It means that if we get new authorization of vaccines and they've been manufactured, we can get them out immediately. If our push for Operation Warp Speed is answered and they say, yes, we'll give you more vaccine, we're ready to get it out immediately. If the letters I just sent out to Pfizer and Moderna get us more vaccine, we're ready to get it out as quickly as we can. We're preparing and already are at, but preparing to be able to do so much more than we are currently doing. But we are just so limited by supply. But that is the driver in how we're planning, how Jim Gray is leading our team each and every day. John Boyle from WFPL.
Hi, Governor. The Herald Leader reported a story today showing that Kentucky has one of the highest inmate mortality rates in the country, along with some pretty severe clusters at some prisons. And it looks like the death rate among inmates is 5 times the general population state average. So giving those numbers, I'm wondering if your team, if that creates any urgency to prioritize prisoner or inmate vaccinations when that becomes possible.
And what we've seen in our prisons, at least in terms of cases, is a lot like what we saw at our veterans' homes, in that the ones right now that have so many cases, many of them fought off having even a single case for 10 months even. I mean, that is incredible. That is working so hard, but the level of community transmission got so high, we couldn't keep it out of places where it spreads very quickly. Now, we took some steps early on, especially allowing low-level offenders who had completed a significant portion of their sentence to ultimately finish that out at home or to have an early release. One challenge we have is in our prison system, we have a number of individuals that have significant health issues that make them that could impact what type of overall outcome there is. We are looking in terms of our vaccination schedule where we believe that we could get to these individuals, but it's something that we're certainly watching. We're doing our very best to separate populations. It is a reflection, though, the number of cases of what we are seeing in overall community transmission around the state. All right, Karen Czar from WUKY says, are there plans to increase the staff at the UI call center? We are actually exploring and looking to move on a couple of different models, but certainly focused on getting more calls answered, and answered by people who are qualified to fix the problem when they answer. Early on, we had a contract with an outside group where you could call and get somebody, but they couldn't help you. And that wasn't, in the end, helpful. It may have been more frustrating to people. So in our goal to continue providing better service, that's what we're doing. Now our typical Thursday UI update is moved to Monday. Amy Cubbage, who provides that, isn't feeling well today, and we're at that time where anybody who's not feeling well, we need to make sure that we look out after them first. But we're going to be able to show you numbers on Monday of overall outstanding claims, but ones that have the identity and or fraud issues, and then the numbers that don't, that we think are the real folks that are still waiting to have their claims processed. Ohio and West Virginia said they had shortages of the vaccine after shipments were delayed. Is this what we're facing? Well, what we're facing is just not enough. It's just not enough. Even if it's delayed, it's not close to enough of what we can do. And we're not seeing the type of vaccine hesitancy that people expected at the moment. We're seeing people who want it so desperately, so many groups that deserve it and need it. Our bigger challenge is patience, but we've just got to have more. If we can, we have the structure, which was the problem in the beginning. The federal government sent us vaccines before it sent us dollars to help build out the structure. And we didn't know we were going to have an authorized vaccine until about 4 days before we got it. Now we're in a totally different place. You give it to us, we can get it in people's arms. We can get it in people's arms in less than 7 days, but you got to send it to us. How are COVID-19 vaccines allocated to counties? So currently it is regional, and it is regional by population, but understand that we had very specific programs that have come first. So when we sent out for healthcare workers, we sent it to hospitals with healthcare workers, and then created a regional network where other healthcare workers could get it. Long-term care is a specific program done by Walgreens and CVS, and K through 12 is a specific program that is sent to one provider for one school system. Outside of that, and that's taken up a whole lot of our supply, it is done regional by population and by amounts initially sent out for especially healthcare workers. Rural Kentucky got a higher percentage by population than urban Kentucky. And so I see different comments and statements about we're getting left out here or there. And I understand them, but it's all a result of just not enough. That's the challenge where we are right now. It's just not enough. When we look at 1B, individuals over 70, K through 12 workers, first responders, we think that number's over 500,000 Kentuckians. We're getting 56,000 a week. I mean, that just takes us 8, maybe 9 weeks to just get the amount needed for those individuals, and we've just been in 1B for weeks as we work through it. So we're all emotional about this. We all want the vaccine, and so oftentimes, if it's not there, it can be we're being overlooked. There's just not enough yet, and the more they give to us, the more we can get out to more places across the country. Same message to people who are eligible for the vaccine and trying to get an appointment, but they book so fast. When we open up to 1C, there's over 1 million people in that. 56,000 doses, if that's all we get a week. You can do the math on how tough that's going to be. And those who are frustrated teachers are getting to jump the line ahead of those ages 70 plus. First, they're being done at the same time. But every business, every parent, every grandparent wants to get their kids back in school if it's safe. It's going to be safe if we can get this done. This is critical to the function of our society, and we're going to hit this at every stage. Even those that are within 1C are going to be upset that they're seeing somebody else in a different situation. maybe somebody in a grocery store that might be younger or healthier, but they're exposed to more people than somebody 65. So please try to be as understanding as you can. This is going to be the hard process, but we're doing it better than just about anybody. We're doing it faster than just about anybody. All right, Tom Latek from Kentucky Today.
Thank you, Governor, and good afternoon to you, sir. These may be Dr. Stack questions, but I'll just go ahead and throw them out there. First of all, do we have any numbers on the percentage of those who have declined that have been offered the vaccination? And secondly, can you mix them? Can you get your booster shot? If you have Moderna, for your first shot, can you do Pfizer as the second one?
All right, the second question is no. If you got Pfizer, you need Pfizer. If you got Moderna, you need Moderna. And then let's go over to Dr. Stack for whether or not we have exact percentages of who have declined. I guess that question would have to be in the long-term care sector or in sectors where we know how many people there otherwise are.
Thank you, Governor. Can you hear me okay, Virginia? Wonderful, thanks. So I don't know that we have scientifically validated data on what percent are declining, and it varies significantly by the population. So in the nursing home setting, we probably have an acceptance rate that's 90% or higher, which is exactly what we would hope for. We'd like 100%, but 90+% is good. In some communities, though, and in some populations, we've had uptake as low as 45%, as I understand it. So there's a range, and we're early in the process. We are finding that in some settings, as the first wave of people get vaccinated, and those who decline at the beginning see that their counterparts do just fine and tolerate the vaccine quite well and don't have any issues, that when offered an opportunity later, people who initially didn't accept the vaccine are willing to accept it at a second offering. And so I think what we will find is that people in society will more generally get comfortable as they see more and more people get the vaccine with good results and be protected from severe disease. So I wish we had a more precise answer for you, but it's probably just simply way too early in the process to be precise.
And Tom, I think the point that Dr. Stack just made is important. The no's that we're getting, most of them aren't hard no's. They're what I would call a soft no. It's not that people aren't going to ever take it. It's that they want to watch a little bit more before they take it. And that's an encouraging sign. But certainly, I don't think that we are going to be at the point where we can't fill up every appointment for every person that wants it based on supply versus demand for months and months based on any type of hesitancy. Alex Akisto from the Lexington Herald-Leader.
Hi, Governor. Actually, I have two quick questions. So one, what have you heard from the federal government in response to your January 19th letter asking them to double Kentucky's allocation of doses? And sort of, off of that, what assurances do you have that the state will actually increase in time for the high volume drive-through sites that Kroger is supposed to set up in 2 weeks? Secondly, to piggyback off of Tom's question, it seems valuable that the state would want to track compliance rates among staff in long-term care facilities and among correction staff, where we know the virus is spreading like wildfire right now. If the state is not tracking that data, why?
So on long-term care is the answer that I can give you. We're not running that program. But we will check with Walgreens and CVS to determine exactly what type of statistics they have there. So I have not received a direct reply from my request for the federal government to double our vaccinations. However, the president today said one of the major things that he is going to do is push to increase supply. I've certainly been talking to members of his COVID task force saying it's all going to come down to this. There are some other fixes, efficiencies, or the like that we can do, but to vaccinate faster is all going to come down to supply. It also appears that the federal government's going to set up some vaccination facilities themselves that wouldn't count towards our allocation. I'll certainly take any of those that we can in Kentucky, which would increase our supply. Let me talk about the last piece of the regional sites with Kroger. We are going to need those and other partners that we are using, even if we don't have a significant increase in our allocation. The reason is the difference between serving a group like 1A, healthcare workers, 1B, people who are 70 and up or K through 12, and then 1C. So 1C has 1 million plus people in it. And so if you are opening something up for appointments and you are a major provider in 1C, you need the call center or the IT infrastructure to handle 300,000 people getting on and trying to book an appointment in the first 30 minutes and your system not crashing. I mean, that is really important. You need to have the sophistication to book them when they do this for their booster shot that's coming, and to be able to plan how those doses work. You need to be able to report the large number of vaccines that you're going to be able to do to the federal government as is required, and to be able to deal with maybe there's more as our allocation goes up. And how can you, if you have a waiting list of 90,000 people, do that in real time to get people there? And so as we look at serving larger populations, some of the tools are different, and that sometimes requires different partners. When we're looking at groups like first responders, there are certain groups out there already in communities that are in a wonderful position to do that, like schools. But as we serve broader groups, it does take more infrastructure than in some instances even the state would have. Whether or not if we had, which a couple of states have tried to do, an overall webpage for signing up, what we're seeing is other systems crashing. So ensuring that we have the type of partnerships where that's not an obstacle that we face. Sarah Ladd from the Courier-Journal.
Thank you very much. So 2 quick things. A, what is your reaction to President Biden's new mask mandate? And the second thing is, are providers complying with using up the vaccine that they get within that 7-day request period? Thank you so much.
So the mask mandate by the President Biden requires anyone on federal grounds and federal buildings, and then in certain, we believe it'll extend now to certain transportation that is federally regulated, have to wear a mask. Is wonderful. It's great. It coincides with the mask mandate that we have here. It's absolutely necessary for us to get through the remainder of this virus for everybody to wear a mask, and this, it doesn't send mixed signals. It's very clear. From our numbers on the state-run program, we're vaccinating more people per week than we actually get supply, and that would suggest that we are meeting the goal. Now, we are working to have very specific reporting, and we're still putting this into place where we can look at every single group that we sent vaccine to on a daily basis, tracking it back, and say more than 90% is getting in people's arms. We want to create that type of accountability. But I can tell you, based on the rate that we are going at, we're going to exceed 90% here in the next couple weeks. My big worry is if supply continues the way it is and we get better and better, we'll get it on a Monday. We'll be through it by the end of Wednesday, and then we'll sit around and wait for it at the beginning of the next week. And none of us want to be there. We all want more vaccine. Joe Ragusa from Spectrum.
Hi, Governor. So a couple of things. I want to first get your take on President Biden's bigger COVID-19 response plan that he released earlier today. If you've gotten the chance to really look through that and get a response to that. But second, as far as vaccine availability, just how critical is the request that you had made to double next week's shipment in regards to the state's ability to administer vaccines to people who have not received their first dose yet? I mean, are we, at a critical point here where we're not really able to vaccinate a lot of people next week if we don't receive those extra doses?
So we're still on pace to be able to vaccinate people with their first dose and still get second doses into people. So that's not our problem. Our problem is we can't do enough of both. And I think that the president's overall plan, as I look at it, has a number of good pieces. Again, I believe a number of those pieces, though, require significantly more supply. I want to be able to get this vaccine to every pharmacy out there. Our independent pharmacies do such a good job. But at our current supply, when we look at the number of providers that want to do this, we would give everybody 36 doses a week, 1,500 groups, 1,500 phone numbers. I mean, could you imagine what it would be like to be an individual trying to figure out which one to call to get in those 36 spots? So what I communicated to the task force the other day is a lot of good parts in this, but it's all based on supply. Now, we are already getting communications from different parts of the federal government saying, "What can we do? What can we do?" And we're gonna take them up on those offers. It appears that some new resources are going to be available in terms of people power. And hopefully some other options out there. So we're seeing people trying to think differently and do more. How much more we can do or how much more people will help will all depend on how much vaccine we have. Melissa Patrick from Kentucky Health News.
Hi, Governor. So I want to just go a little deeper with the potential vaccinating our inmates. The numbers, the numbers are just awful there right now. North Carolina and Virginia are now vaccinating their inmates with as supplies become available. And you've said you're looking at the schedule. Is there any chance that inmates could be included in the 1C group in this next group that's coming forward? Can you expand on what that means looking at the schedule?
We're evaluating. We haven't made a decision there yet. Certainly, prisoners won't go before individuals over 70, won't go through our K through 12 personnel. Certainly individuals 65 and older and some essential workers in key areas are so critical. So right now we haven't made a decision about prisoners in terms of whether they will or will not be in Group 1C. They are not currently there now. Shelby Smithson from WKYT.
Hello, Governor. When the regional vaccine centers open up, if supply is still the major issue as we're expecting it to be, could some health departments and hospitals who have already been vaccinating see a decrease or even a complete cutoff of doses being shipped to them?
Yeah, as we move to different phases, that's going to happen, and we need people's patience with that. Again, if we move to a phase where anybody who has vaccine may get 100,000 calls, who has the infrastructure to handle that changes, and we hope providers can understand that, right? That our goal here is to vaccinate as many people as possible, to give people as much certainty about when they would be able to go. So let's take a group that has about 30 people that work for it that has been getting vaccines. If we open it up to 1C, and again, 100,000 people start calling, I mean, 99% of them aren't going to have the call answered. And so I hope we know that we can all play as providers a central role in the pieces that we can do best. But I also hope that at a time like this, where people's lives are on the line, that we understand, even if it's a competitor, even if it's somebody across the road, that another provider might be asked to help at a different point in time. Again, it can't be a me, it's got to be a we. It can't be about profit, which I don't think anybody's looking for. It's got to be about understanding that everybody needs this vaccine, and we need to try to address challenges and anxieties as we go. John Charlton from WHAS.
Thanks, Governor. Hope you're having a pretty good week here. Well, last week, Amy Cubbage said that those who have exhausted their weeks of unemployment should not have to refile for the new federal extension. However, we're hearing those folks are being told by the system to refile. Are you aware of that problem? And also, Ms. Cubbage said we would get the numbers on how many unresolved claims are processed on average each day and each week. But after repeated requests for that information, we still haven't gotten it. Do you have those numbers?
I don't have them with me, but you deserve it. If we said we would get it to you, I will say one challenge is when you were working with the computer system originally put in place in the 70s and the last major update being in 2000, oftentimes they have to code it just to get the numbers. But let me look in to both of those, John. And if we didn't get you that information, that's on us, and people deserve that information. Again, I will say that now we can identify total claims, how many of them have major identity issues, as well as other fraud flags. As we've seen in a number of stories, there's certainly a lot of fraud out there in the country. And just one business in Lexington, I think, identified over 8 fraudulent claims associated with it. We are working on that right now. I think when we are able to process those, which will be denials, you'll see a significant decrease in claims because those have been sitting on the books. Even though there's been no effort on the identity side in any of those that are still sitting there. But what it'll also do, if there are valid claims in that group, is move them further in the process and get them out of a purgatory they may be sitting at, where we can get them at least in an appeal where they can move their claim forward. So that'll be coming in the coming weeks. Again, we think that there are more like 30,000 real individuals out there that may be entitled to benefits that we haven't been able to get to yet. Lee Searcy from WLEX.
Governor, thank you so much. I have a couple of questions. Speaking of unemployment, as you're well aware, thousands are still waiting on their benefits, and many have claims that have been listed as under investigation for months and months now. How much longer are those folks expected to wait? And also, we've talked to a number of people who've tried to schedule the phone appointments to get help, but they say the website is down, or they tell us that no appointments are available. What are those people supposed to do?
So the phone appointments are filling up, which is good. That means each appointment that is filled, while not the person that you're talking to, is someone that is getting help, is working through the process. And so, continue to get on each day to try to schedule that appointment. Now, somebody whose claim's under investigation, each one of them is going to be different. So to say I know exactly when someone's will be resolved is difficult. If it is under investigation, there are issues that need to be worked out. Again, this is one of the reasons that in my budget, I asked for the legislature to fix some harm they inflicted in the past, which was removing 90 plus individuals that right now would be processing claims. They'd be helping those individuals, replacing this IT system, which, again, you got to code to get basic information. If you code it differently, that basic information can come out differently. I mean, this was created when the first flip phones were coming out. That's the technology that we're dealing with. But there are people that have not been helped, and we continue to work to try to get them that help. All right, 2 last written questions. One is the speed at which K through 12 educators are getting vaccinated. We're excited about that. Right now, it looks like almost every K through 12 educator is going to get their first shot. And this is all the K through 12 personnel. This is public and private, are going to get their first shot of the vaccine at the latest the week we thought we would be starting the vaccines. And so there's a question, would I have an executive order to mandate the return to in-person learning? I'm not going to have an executive order. People are ready for it. What we will be able to do is change our guidance. that right now suggests different forms of learning when counties are in different places. We will be able to ease that guidance, we hope, significantly once those personnel are protected. And so that's the way you'll see us responding. Our recommendations, depending on where a county is, for instance, is where you'll see those changes. And last, we've seen a sharp increase in the past 2 to 3 months in Muhlenberg County. We're moving from phase 1A to 1B. Our county health department is out of doses. One reason for this is that the K through 12 program is going on right now, and a specific provider has been picked and is right now working, I know, on providing those vaccines for the K through 12 system. So it's not that any rural health department or any other area is being ignored. In fact, by percentage, I believe we have sent more vaccine to rural parts of Kentucky than on urban parts of Kentucky. But as there are different phases, K through 12 being one, there are going to be different groups that may be able to serve, because what's most important is the people who need the vaccine, right? Not necessarily who's getting it. There may be different groups that are better to get the vaccine in those individuals. And again, as we expand who is eligible, it may change who's in the best position to handle those influx. So the same provider isn't necessarily going to be providing vaccinations throughout the entire pandemic. And everybody who signed up to provide, unless we get more supply, isn't going to be able to be a provider. Our job is to make sure that we do it in a way that helps as many people as we can, that gets it in their arm as fast as possible. And when you hear about provider X or provider Y, maybe they're having a change, I know it's easy to think, but we're being overlooked, or us in urban Kentucky, or us in rural Kentucky, or us in this county or in that county. Folks, we're trying to get it to everybody, but we're trying to get it to everybody as fast as we can. Nobody's overlooked. We care, and I care about each and every one of you. And that means making the decisions that, again, might hurt different groups' feelings. I hope they don't. We should have the same goal, but we got to make the decisions that get them to you as quickly as we can. So hang in there. Try to have patience in this very difficult time. I know you really want and need the vaccine, and your neighbors do too. We're working as fast as we can, and I'm putting every bit of pressure I can on the federal government. I want you to have that vaccine, to have that protection. And we're going to continue to work at it day in and day out. I want to thank everybody for joining us. We have gone about 10 minutes over. And I want to say again, especially in what I'm seeing in mask wearing, I'm really proud of you. In many ways, we are, I believe, at a point that we were many months ago, recognizing how serious this is and what we need to do to continue to fight it. And we will be at a very different place, especially by the end of this summer. So hang in there. Keep wearing that mask. We are going to get this vaccine out. I love that everybody wants to take it. And everybody will get a chance to take it. We're going to get through this. We're going to get through this together, whether it's mitigating the virus, whether it's the vaccinations. At the end of the day, everybody is going to be able to get it, and we're going to be able to defeat this virus. And I got to tell you, I hope I get to serve in this job a lot longer, but once we can put this behind us, it'll be an incredible day. I think it'll be an incredible day that we will all remember. And tomorrow, we'll provide the video. We're going to be able to commemorate all those that we have lost. The numbers are staggering. The depths of our tragedy and our sorrow are significant. And we must honor those individuals, and we must promise to do better, while at the same time, as we look at brighter days ahead. So everybody hang in there, wear your mask. We'll see you back on Monday.